We are dealing with yet another surge in COVID cases. It does feel uncomfortably familiar, but some things have changed.
That's right. More people are vaccinated, including kids as young as 5. Booster shots are now available, but we also know that Omicron, this variant itself, is also very different.
To talk about what you need to know about this variant and what we know about this surge so far, in our KSAT Q&A today, we are joined by local epidemiologist Cherise Rohr Allegrini. Cherise, always a pleasure to have you here. We like to call you the disease detective because you study these things, you know how these trends work. So let's talk about the severity. I've heard people say, well, Omicron not as bad as Delta. Is it something we need to be concerned about?
Both. It's not as bad as Delta, but it's more contagious. That means you're going to have more people affected by it. And we know that the 2 doses of the vaccine are not quite good enough. So we need to get that 3rd dose in, but it is more contagious. And it's just a numbers game. The more people you have infected, the more likely that you're going to have folks that have severe disease because it's out there. Whereas before, it wasn't as contagious. So it's good news and bad news.
Okay, now we have the rapid test, the PCR test. We have those at-home testing kits. And a lot of our viewers have been asking whether the at-home kits, for instance, are sensitive enough to pick up the Omicron variant. It's something a lot of people are worried about. And you're saying that it is.
Right. The at-home kits are great. They are sensitive. They're not as sensitive as the PCR test for sure, but they are sensitive. And if they're done properly, which means you really get that Q-tip up in your nose, rub it around at least 5 times on each side, and you do it properly, there's a good chance it's going to detect if you're infectious at that moment. It's not going to detect if you've got very, very small levels of virus that haven't really become infectious yet. But it is a good indicator of if you're contagious right now.
You know, this surge does feel different than the Delta surge. I think, of course, because symptoms aren't as severe. But when you look at the positivity rate, it's over 27% in our community. That is very high. So I know, Omicron was first discovered in South Africa, but when it peaked there, cases seemed to really fall off after that. Are you expecting something similar here?
So I'm really hoping that I'm going to see the same thing, that the peak is not going to last very long and it'll drop off quickly. One thing to note about the positivity rate is you have to understand the denominator. I just looked at the number of tests where we got that 27%. So in December, we were testing between 50 and 60,000 a week. That 27% is based on less than 30,000 tests. So that's going to skew it a little bit, but we still have over 8,000 that we're testing positive. So that is very concerning. But again, because we've got a fairly good rate of vaccination, we still need to work on it, but it's not too bad. And because it's fairly mild, I suspect that we're going to see a lot of cases in the next couple of weeks and then it drop down again. At least that's what I'm hoping.
When we see this surge, I'm going to bring back one term that I know epidemiologists hate, and that is herd immunity. We stopped talking about that for the last few months, but I'm wondering how that would apply to the Omicron variant if you do have a lot of people who are testing positive and do come down with the Omicron variant.
So let me tell you, we love herd immunity when it's actual herd immunity. And that really is vaccine-induced herd immunity, which means that you have very few people in the population who are susceptible. And so with the Omicron variant, we're seeing that there's a higher rate of people that are susceptible because we only have the 2 doses of vaccine and it's just not good enough for that variant. But getting that 3rd dose of vaccine can really make a difference. And then we could actually see herd immunity, which means that we'll have very few people in the population who are susceptible, which means our cases will go down.
I've heard people talking about where we are right now saying, well, this is less severe than Delta. Hopefully the next variant after Omicron will be less severe. The threat level will go down and down and down. Is that safe in thinking that this is how viruses work?
That's not how viruses evolve. They evolve randomly. It's because there's mutations every time it makes a copy, and most mutations mean nothing and they don't change the virus at all. Occasionally you get a mutation that is effective for the virus. It gives it an advantage and it survives in the population. And that, whether or not that's going to be deadly or not, we don't know because it's very random. Now, the less severe a virus is in terms of the illness it causes, the more likely it is that that virus is going to survive. survive. If it becomes deadlier, say it kills people much faster, it makes them very sick very quickly, the folks aren't going to be transmitting it. They're going to go into hospital right away. They're less likely to be out and about. They're not going to go to the grocery store coughing on folks. Whereas if you have a very mild variant, you're more likely to continue on about your daily life, and then you're more likely to transmit it. But that means it's less severe. So viral evolution is such that we can't say it's going to decrease in severity over time. It's simply not how viral evolution works.
All right. Cherise Rohr Allegrini, thank you so much for joining us today and giving us the latest information that you know about the Omicron variant, something that we're all concerned about. Thank you.
See you next time. We'll be right back.